Hi, it's Terry Irvin from Time Bump and Beyond, and I wanted to just do a really quick video for you today to talk a little bit about harvesting colostrum. With one of my mums, she's due in for a cesarean over the next couple of weeks, and we talked about harvesting colostrum as something that she can really do to ensure that she has a little bit of feed ready before baby's arrival, just to give her a little bit more peace of mind. So if this is something that troubles you, this is something that you can do, or really in any case you can harvest colostrum. So you might decide you're not going to go down that breastfeeding journey, but you want to ensure that your baby has those vital nutrients at birth. And you might decide that you want to continue with the breastfeeding journey. You might harvest colostrum and then you might never need it, which is absolutely great, and that is a wonderful outcome. But colostrum can be used as a skin healer as well. So if you have any nipple trauma following birth, this is a great way to be able to help soothe and heal that nipple tissue as well. So what we're going to do to harvest colostrum, 37 weeks, and you must discuss this with your caregiver or your midwife or your obstetrician before you decide to undertake this, because it can in some cases bring on labour, so some cramping can occur in some cases, so it's always worthwhile discussing that with your midwife beforehand. Now, to harvest colostrum, you are going to pick up some of these little tiny syringes. They can be collected from Amazon, major retailers, or your midwife may be able to support you with them as well. And they're all sterile, so they come all in their individual packs, so just take out whichever one that you need. Make sure your hands are nice and clean. It's great if you've just gotten out of the bath or out of the shower, because you'll have a bit of warmth in the body as well, and the breast tissue will be a bit more supple. So what you can do is work onto the breast tissue and warm it up slightly, a little bit of massage around that breast tissue. You can then create a little C with your hands, and you're going to work just down the breast tissue, just above the areola, in between the areola and this top of the breast. You're going to see some or feel some little tiny lumps under the skin, a bit granular. And what you're going to do is you're going to pull back ever so slightly, just very gentle, all of these movements, and press down and move out with the fingers. So back slightly, press down and move out. So you're going to do this for quite some time, just very, very gently, not causing any trauma to the breast tissue at all. And you may start to see some little tiny droplets of the colostrum actually coming out of the end of the nipple. And you can keep working the breast tissue, working around in a clockwork motion the whole way around. Now, when these little droplets start to come out, it's a great way to have your partner or someone that you trust really on side to come over and help you with this. And you can then start to collect the little tiny droplets from the end of the nipple into the syringe. Now, you can do this up to 2 to 3 times a day, and in between those extractions you can leave the syringe in the fridge. Now, when the syringe is completely full, you can then pop it in the freezer into a little Ziploc freezer bag, and it will keep in the freezer for up to 6 months. So what you'll do is, after you've collected, when you're heading to hospital, if that's where you chose to have your birth, or birth centre, or even if you're at home, you can keep them in a little freezer insulated bag with a little ice block in there, and make sure you've got them on hand. So if you are separated from the baby at all at the very beginning, you have that first feed there. Now, remembering that colostrum is a yellow, thick substance, it's actually absorbed through the soft palate of the baby, so you don't actually need a lot of this. So we'd always encourage you to go breastfeeding first. So again, as I said, if you've collected it and you end up not using it, that's a great outcome. But for those who just want that peace of mind, to know that they've got their milk, to know that their milk is coming in, and familiarise themselves with actually doing some hand expression, this is a really great tool to prepare yourself for birth. So thank you for watching.